Are you experiencing stress and anxiety? Psychiatrist Dr. Lisa Zucker will offer advice for managing it. That's next on Wellbeing Matters. MCPS staff members, welcome to this first episode of Wellbeing Matters, a new series focused on health and wellness topics just for you. Dr. Zucker, thanks so much for being here today.
Thanks for inviting me.
Sure. So let's get right to it. Anxiety is a common problem right now due to the serious and very real stressors that we're all experiencing. What exactly is anxiety? And if you would share the signs and symptoms of it.
Sure. So anxiety is an experience that is felt physically and emotionally, and sometimes in our thoughts. It's an experience that happens in response to danger or threat. It is a natural and normal human experience, and we've all had it. When we've stepped out in traffic and we have a near miss with a car, we have our hearts start to race and we might catch our breath. That's anxiety. When we're overwhelmed or excessively worried, that's anxiety. Typically, signs and symptoms of anxiety can happen in three areas. The first area would be emotional or thought area. That might be a feeling of dread, a feeling of nervousness, but also the excess worry that I just mentioned. The second category where anxiety manifests frequently would be physical sensations like muscle tension, racing heart, shortness of breath. Sometimes there's stomach upset or headache, also difficulty sleeping, and sometimes difficulty eating. The third area that we don't think about as much are behaviors, anxiety-related behaviors. Typically, anxiety-related behaviors might include difficulty or inability to separate from comforting loved ones, avoidance behaviors, changing the lifestyle to avoid the threatening situation. If somebody is afraid of flying and there's a wonderful family event, a person with anxiety might opt out of the family event in order to avoid flying. And finally, behaviorally, people might use substances, alcohol, or other addictive behavior to quiet the anxiety symptoms.
Thank you. That was very informative. So how do the signs and symptoms of anxiety differ from the stress that we experience day to day?
Yeah, that's a really good question because they're related and there is a lot of overlap between stress and anxiety. Technically, stress refers to an external situation or circumstance that is causing us to feel worried or nervous. That term stressor refers to these external circumstances. Examples of a stressor might be a deadline. I have a deadline, lots of pressure, maybe not enough time to get the project complete. But typically, once that deadline comes, whether I've met the deadline or not, it's come and gone and the anxiety quiets down. Anxiety, on the other hand, can be internal. The feelings of worry and stress can persist beyond the situation that originally caused the stress. Sometimes the experience of the two can be the same, feeling on edge, keyed up, irritable, having difficulty concentrating or sleeping. But if you think about it in terms of the origin, stress being external and anxiety being internal, it helps make those relatively artificial distinctions.
I see. Thank you. And so what are some steps that we can take to decrease our anxiety?
That's a really good question, and it's an important follow-on to the question about stress versus anxiety, because remember, stress classically is thought of as external circumstances that come and go. We actually are wired to respond to stress with anxiety, in fact, to keep ourselves safe. Tens of thousands of years ago, we would sense danger or threat, and the anxiety response muscle tension, ready to run, racing heart so that the blood can go to our muscles so that we could run from the predator or fight. It's the same response as anxiety. The problem is that modern day, and particularly this recent many months, really difficult in that the stressors aren't ending. We're in the middle of a global pandemic. We have the devastation of that experience, the impact on our lifestyles. We haven't been able to see our families. We're afraid for our families and friends. But what about the economic turmoil, the political turmoil? And then there's this other parallel process, which isn't new, which is the pandemic of racism. And it's very much in the forefront. So what do? Because we can't wait for it to end to feel better. What is really important are very concrete stress management strategies. And if we're able to practice stress management strategies on a daily basis, we can minimize the chances of full-blown anxiety. So really basic stress management practices would be good sleep, protecting sleep, going to bed at the same time every night and waking up at the same time every morning, getting regular physical activity, reaching out to our families and friends and communities, even if we can't see them in person, taking advantage of virtual connection. Also mind-body strategies. That would include yoga, meditation. Many of us can access meditation apps on our smartphones, but you could be just doing a breathing practice, and that would help lower the anxiety. Deep breathing, staying away from media, turning off the screens as much as possible, and trying not to use alcohol or other substances because that tends to make anxiety worse.
So you shared some really, I think, important strategies, but how do we know when we might need some professional help?
Seeking help under protracted and stressful circumstances is in order, no matter what the manifestation. If you're uncomfortable and you feel you need support, reaching out would make sense. Classically, I would recommend reaching out when the anxiety is taking over, when it persists or interferes with life, interferes with work or relationships, sleep. Sometimes there are physical symptoms that start to be unrelenting, headaches, stomach aches. So basically thinking about persistence and pervasiveness and interference with functioning, that would be the time to ask for help.
You know, I have to share that when you said when the anxiety is taking over, that's a signal. And I know for me, that really hit home. I think that's a very easy to understand way of knowing when you might need help. So that being said, if I were to make an appointment with you or with another psychiatrist, what might I expect?
Sure. And what I'll also say is very often when one is experiencing stress, anxiety, or other mental health issue, there are a number of different professionals that a person can reach out to. A psychiatrist is one of them. Psychiatrist is a medical doctor. So if you're going to meet with a psychiatrist, somebody like myself, we would have a conversation and we would talk about the symptoms and the experiences that are interfering with your life that are overwhelming. But we would also need to do is be sure that there aren't any ongoing medical issues that could contribute to the experience of anxiety. We would talk about different medications or supplements that you're taking that could be contributing to the anxiety. After that, we talk about the symptoms, trying to characterize them, sometimes learning more about your social and personal history. And the reason why the conversation is so detailed is that it's important for the mental health professional that you're meeting with to understand your unique circumstances. That is the best way to develop the best recommendations for you. Recommendations might include just practicing stress management and lifestyle modifications. Sometimes talk therapy or the word psychotherapy is recommended. A specific type of psychotherapy, which is particularly good for anxiety, is something called cognitive behavioral therapy, or CBT. That's where we look at thoughts and behaviors and emotions and how they interact to create anxiety. And sometimes prescribed medication makes sense for an individual.
Excellent. Dr. Zucker, thank you so much for being here today, for sharing your knowledge and your expertise. I think you really helped us all to understand anxiety better and to be able to differentiate between anxiety and stress.
Well, thank you. Pleasure to be here.
The Employee Assistance Program is here to help too. We offer no-cost counseling and referrals to providers. Thank you so much for watching Wellbeing Matters, and be well, everyone.